Hi there, I'm David King-Lassman, and this is ExploreXR. And today I am thrilled to be joined by Dr. Jane Frost from the University of Canberra in Australia. Hi, Jane. Welcome. Thank you so much for joining me.
Hi, David.
So let's kick off. Just let our audience know a little bit about who is Jane Frost. What do you do? And how did you get here? Let's cover that ground.
Well, hi, everyone. My name's Jane Frost. I'm an associate professor in nursing at the University of Canberra. And I was a really early adopter of mixed reality in nurse education. So I have been a nurse educator for 9 years, and I'm passionate about simulation and innovative ways to get students immersed and involved in education, and so I think that's enough.
So mixed reality. What drew you to mixed reality as a medium way back when, before it was really people even knew the term?
Look, I've always been interested in different types of simulation. I have used MaskEd, which is a simulation where you use silicone props to become a character. That simulation was developed at Central Queensland University by Professor Kerry Reed-Searle, and I have adopted that quite widely. And that really created some engagement and really got me hooked on innovative ways, I guess. And when I was introduced to mixed reality, I immediately saw its potential in the nursing classroom, and have since introduced it to colleagues in health, and we've been using it in both nursing, but also in interprofessional learning also.
Okay, well, we'll come back to mixed reality, but you mentioned MaskEd, and for anybody listening, I think it's well worth checking in on your TEDx talk, where you introduced the world to Marjorie, who's an 81-year-old diabetic, and it's quite extraordinary because you wouldn't know that there's Dr. Jane Frost behind the mask, and the reveal is quite amazing. And I dare say that there's an actor inside of you, because you do a phenomenal job representing an alter ego. How did it help in your teaching to use that kind of simulation? Because it's quite unusual. I'd never seen it before.
I think it's the engagement that it fosters with students. If you go into a class and just pretend as yourself and ask them to do a role play, you get mixed responses. Whereas if you are in character, so in character, I am Marjorie. I don't respond to being called Jane, and my voice changes, and the way I walk changes, and I'm completely in character. So the students actually treat me as Marjorie, and I can steer conversation if I need to from within the character, but also correct and sort of coach students into that kindness and compassion, and sometimes how to actually phrase questions and ask about things.
Right, that's fascinating. And when you get to meet Marjorie, it's not just Marjorie you're meeting, but her whole story. She talks about her husband, and her husband who has Parkinson's disease. So we build a picture, and we start to get presumably an empathetic response. And you mentioned it just moments ago about kindness and compassion, and how there are theories out there that helps to drive health outcomes in a really positive way. Can you talk a little bit about that? Because that's a very interesting component of medical training, right? We always think about how to do a procedure effectively and well, but that empathetic part of being a medical practitioner is incredibly important.
So there's lots of research out there about empathy and actually understanding what the patient is going through. We have person-centered care, where we try and understand what a person is going through. But actually, when you're training nurses and they are trying to understand, for example, diabetes. So we'll kind of move on from Marjorie and sort of why I gave her diabetes, because actually that was in the curriculum and they needed to understand the disease as well as the experience of the person. It is really important for therapeutic communication to be empathetic and to be able to understand from other people's point of view. So MaskEd has really helped me to do that. There are some other simulations that have also helped me to do that, where you can actually view from a first person perspective, and that's more from a virtual reality point of view, what it might be like to experience something.
And in simulation like MaskEd, are you able to kind of quantify the benefits? Has your research extended to sort of empirical results that show that this really helps to drive outcomes?
Yeah, there's lots of research into MaskEd, and it is about that engagement, but it also increases preparedness to communicate, because I think sometimes our younger students, and not necessarily, I'm not being ageist there in terms of just our younger students, but some students come straight from university and don't have as much life experience, so aren't used to communicating, and find it quite daunting actually talking to patients or people that they're looking after in about anything other than their illness. And actually there's so much more to that person that we need to understand to care for them properly.
Right. And I know that, mixed reality it's quite a nascent technology. And I know that you've been using one of GigXR's product, Hollow Patient. And while you don't necessarily get the kind of interaction that you might get with Marjorie, you are able through mixed reality to broadcast, hyper realistic content into the space and interact with it, walk around it, and so on. How has that played out over through the years that you've been using that kind of technology? What sort of impact is that making in the classroom?
The research that I've done into mixed reality, so I have done quite a bit about the use of mixed reality in nurse education, and it really is about clinical reasoning. We talk in nursing a lot about thinking like a nurse and the clinical reasoning cycle. There are theories such as Tanner's theory that actually looks at clinical judgment, and the first bit is about noticing, and noticing is really something that we don't get time to do in a clinical area very often. So for example, GigXR has a patient who's experiencing an MI or a heart attack. If that was happening in the clinical area, there would be no time to stand back and go, okay, so how is the patient breathing? What signs and symptoms are you looking at? What are you seeing from this patient? You would have to act immediately. What mixed reality in this platform does is actually give you that space to be able to have the time to look and to actually go through a process of deduction almost around what is happening for this person, and what is it that I'm looking at? I'm looking at the expression. I'm looking at how they're rubbing their arm, perhaps. How am I linking that to the pathophysiology of an MI? So it's using that as a platform to then link everything else that they're learning and sort of bring it all together. I like the term epistemic fluency. So that is kind of bringing together all different ways of knowing. So we know things in different ways, but we don't always quantify them. So we might have seen somebody who has experienced an MI. We may have been in a clinical area and seen that and observed it before. We may, that's just one way of knowing. So actually thinking about that and actually reasoning around that, and why would a person look like this? What is it that they're actually displaying to you? And I guess one of the real positives for me is that it's a very realistic portrayal of symptoms. This is what a patient could, not everybody presents in the same way, but could look like. And this is why so there's another example that I'll talk about, which is a patient who is going into diabetic ketoacidosis. So I teach about blood gases. So the class before, we would talk about blood gas interpretation, and we'd be talking about how the body compensates. Actually, then you can actually see that respiratory compensation in the patient and see what that looks like visually through the HoloLens. So they can really connect the dots. So I think it is a fabulous way of being able to really bring to life some of the concepts and theories that we're talking about, and even the pathophysiology, because then I also use the Holo Human to be able to show what's actually happening in the body at that time.
So how would you have approached that journey before mixed reality then, to try and encourage that connection of the dots between something that is quite conceptual and something that's visual? What tools did you use in the past to help achieve that?
I guess we connected the dots in different ways, but not with the same depth as I've been able to do with this platform. So you can show pictures, but images are 2D and they're not, I think the other thing is that being able to see the patient, you can connect emotionally to the fact that somebody is having respiratory distress, for example. You can immediately kind of see that that person is distressed, and you recognize that. That's not always recognizable when you are trying to replicate that in a mannequin who is lying flat and looks the same as they did last week. It's only when you listen to their chest that you can actually hear the difference in the lung sounds. So we built case studies and we wrote about those things, but actually this gives a way of being able to see them.
Right. And what I'm hearing is that is quite impactful, quite positive, and it's allowing your students to really heighten their clinical reasoning such that when they're in a clinical environment, they're better prepared. It sounds like I'm putting words in your mouth, but is that fair?
Yes. I think a lot of times we relied on students seeing presentations and seeing patients with those presentations to actually be able to see it in real life, whereas now you can actually show a presentation before they go on placement. So hopefully they will recognize it when they see it in the clinical area. So yes, I hope that it is preparing the students for the clinical reality, which is what we're trying to do.
Jane, you've written about being passionate about the scholarship of teaching and learning. Can you talk a little bit about what that is?
Yeah, I guess my passion comes from the fact that there are lots of different applications out at the moment. There are new things that come up every week. And it's really important to me that when I use something new and innovative, that it's not just me that thinks it's cool or interesting or has that wow factor, but that it actually engages the students and actually is meaningful for them. So the scholarship of teaching and learning is really understanding why we're doing something, and then completing research and investigations, and really being invested in trying to get that learner's feedback. So why are you doing something? Is there a theoretical concept behind that you can use? And how does that work out for the learners? So I've done quite a few studies around mixed reality and asking the students really what their experience is. I think when they're very new to it, the first reaction will be, well, I didn't really like the headset, or I'm not used to it, and this was several years ago, they were like, wow, some people really liked it. Some people were like a bit reticent because they were, well, I don't do technology, I don't want to put a headset on, I'm not a gamer. And we've moved on from that, and even over the last 5 years, people are so much more ready to put that headset on. And now there's also the remote option, which, by the way, has been fantastic over in the pandemic, because I've been able to put the headset on myself at home and stream a patient to my students who are online, and actually almost give them a simulation in their own house that they could work through. So that's been really engaging, and a COVID safe way to use the headsets, because I think people are still a bit reluctant maybe to put headsets on.
So mixed reality is having a positive impact then on that scholarship of teaching, and you're finding your students are responding to it really, really positively.
Yes.
Also, you talk about interprofessional education, collaborative practice. Can you add a little color as to what you mean by those terms?
It's really important for any health professional to be able to work in a team. So the research shows that actually we teach in silos and then expect everybody to get on and work together and know what everybody does when they get out into the real world. So interprofessional education is something that's really important. It's now in a lot of accreditation because it's been recognised over the last 5-10 years that actually we need to be introducing it to undergraduate programs so that people start to learn what other disciplines do. Yes, it's important to understand, if you're a nurse, what a nurse does, but it's also important to understand what the physio does and what the OT does, so that you're not feeling like you know who to refer to when. So interprofessional education is about learning together and learning about each other. So I'm involved in quite a few projects that bring people together to actually solve a problem, to either work on a case study together or to work in teams to get to use each other's strengths. There's a very interesting TED talk by Lorelei Lingard, who talks about collective competence. And the premise of this is that it's great if you're a fantastic nurse and you have a fantastic physio and a fantastic OT working with you, but and your individual competence, while important, is not actually as important as a collaborative, a collective competence, and that we all know what each other's doing, because we could be replicating that. And from a patient's perspective, that's really a poor experience when every single person asks the same questions.
Right. Yeah, I mean, I know from my limited personal experience of being treated as a patient that sometimes it's like watching a choreographed machine operate around you when a collection of nurses and doctors kind of do their thing. And I guess it must be quite challenging to train in that sort of team environment so that when, lives are on the line, it works as seamlessly and efficiently as possible.
And a lot of interprofessional learning, or that education, it does happen in the once you've graduated sort of space, but we need to bring some of that back to the undergraduate space as well, so that they're ready to be in those teams, because that's the reality of healthcare, is that you are working in a team. And you're working in a team of nurses, and you're working in a wider team. So teamwork is really important. So there's intra-professional teams, but there's also that interprofessional, and that's really an important aspect to be thinking about.
Yeah, I know. Oh, sorry. Carry on.
Sorry, no.
I was going to say that I know that we're thinking a lot about that. We're thinking about that as we consider, what are the next products that are going to be rolling off the GigXR production line, and this is, conversations that we're having with some of our partners who are guiding the direction of that. And one of the things I think that's going to become a feature of what we do, and what I'm sure mixed reality companies in general do, be using this medium to help in things like team training, because it's such an effective medium to do that, right? You can put your headsets on, and the headsets are only going to become better and larger fields of view over time, and lighter to wear, and so on. And you can bring that kind of digital scenario into the physical world in a very realistic way. I think that's going to be really impactful moving forward. How do you see mixed reality, not just in the team space, but in healthcare training in general, really driving the future of the way that you do things?
Look, I think that there are lots of ways that it helps. And if we just talk about interprofessional education for a moment, we actually did a study using the HoloLens and one of the Holo human patients, and asked different disciplines to look at the same patient. Now, one of the biggest issues for doing interprofessional learning is actually coordinating people being at the same time, and being able to get them together into groups. But also, if you're doing a case study, for that case study to be able to be, if you've got an actor or somebody, to be able to be consistent and exactly the same for a consistent period of time. With the holographic patient, you can know that the experience that every single patient student had was exactly the same, because it's recorded and it's a standard patient. And what we did was we asked lots of different disciplines to look at the same patient and come up with their needs and priorities. And actually seeing the different priorities for each discipline, and then bringing them together was quite eye-opening, that actually we're very focused in health on our own little space. And actually being able to talk to the students then about actually the bigger picture and what everybody else could do and how they could all help in that care was really eye-opening.
And I'm thinking even further down the line, you know, if you could sort of wave a magic wand and imagine some future technology that would address some of the most difficult of challenges that you face as an educator, what do you think is going to come down the line that will really drive outcomes even further?
I think being able to interact with a hologram or holographic patient is a really important aspect. There's certainly one hologram that actually collapses, which I find quite challenging to use, because as a health professional, we want to help, and to actually see somebody collapse in front of you without actually being able to do anything about it is quite a challenging space to be in. That involvement, so interaction, whether it's through haptics or whether it's through being able to have a conversation with the hologram, I think all of those things would be good. I do think that that what we have to do to create the epistemic fluency that I was talking about before is to take the best bits of all the different simulation techniques we've got, so that we are introducing students, and different learners all get to learn in their own way, but they all get that experience. So really, it's about that experiential learning and trying to give people different options, because people do learn in different ways. And this isn't going to be the solution for everybody, because some people are just not going to take to mixed reality or virtual reality, and some people don't like mask ed. You know, it's just not the way that they learn. So we have to be able to be flexible as educators, and to understand that in our learners, and to try and give that range of experiences to augment their learning.
I think that's a really good point, and certainly something that we feel strongly about at GigXR, that you know, mixed reality wouldn't necessarily replace existing analog technologies or other methodologies of training, but really can augment them. And particularly when we're starting to get involved with things like you know, projecting hyper-realistic holographic content onto mannequins, for instance, so that you can push the boundaries of that sort of empathetic response that you want to get from a student, getting a student to start thinking like a nurse or thinking like a doctor. I think that's really exciting. I know that we're putting a lot of research and development into those sorts of areas of you know, of supplementing tools that are already there, bringing it all together in this kind of glorious simulation arena. So you talk a little bit about your students reacting in different ways to mixed reality. What can we do as an industry to make it better for students who are on the sort of fringes, you know, who are not necessarily so enthusiastic?
I think that's already started to happen. You know, the headsets are getting better. They're not, the very first HoloLens perhaps was a little bit heavy and not as easy to wear as the new generation, and there's going to be another one coming out. So all of those things are helping with that. You are always going to get some people who don't like the technology. I found that actually mixed reality is tolerated better than virtual reality, which for some people can cause dizziness, vertigo, migraines, all of those things, because it is so, you're immersed in that, you can't see anything else. Whereas with mixed reality, you can still see the classroom around you, which again is a good safety point, because I can have lots of different students wearing the same the headsets in the same class, not banging into each other, because they can actually see people around them. Sometimes they get quite close to each other because they're immersed in what they're looking at. But it's not the same as virtual reality, where you literally have to have a space and you can only have one person. That I know virtual reality is no longer tethered, but in some ways that actually adds to the problem, because you can't see the environment. So you still have to have a space for them to be safe in. And the remote adds to that. So for those people who aren't engaged in in wearing a headset, or are really just don't want to put the headset on, that's just not their thing, being able to give them an iPad so that they can engage in the same content is a fantastic option. So I think all these things are making it easier for everybody. But as I mentioned, I think there are some people who just don't learn in that way, or don't engage in technology, or perceive that they don't like it for whatever reason. It's not going to be the fit for everybody, but I think most people engage now.
So you've mentioned the remote layer a couple of times now, and of course, through the pandemic, when your students were dispersed, clearly there was a value there. From what we've learned through the pandemic, to what extent do you think the future is going to be reshaped from our learnings, or do you think that we're going to go back to as it was? Do you think that there's a universe where some of the tools that were accelerated in their development, like remote learning, will have a place in the future of healthcare training?
Yes, definitely. I think we're being very short-sighted if we just go back to the way we did everything before, because there are some really valuable things that we've learned, and different valuable ways that we've engaged and created content that has been engaging. So I can't tell you what the future is going to look like, but I think that we will take those learnings, and I hope that we don't lose all those valuable things that have been developed, and new ways that we've done things that perhaps we'd never thought of doing before. Some of those actually worked for some students. So let's make sure we're not throwing it out just because we're going back to how it always was. But also use that scholarship of teaching and learning to actually understand which actually works better, and give students options, because that's what they often want. They have busy lives, and it's no longer the case that students go to university, or very rarely, and don't have to work and do other things and manage other commitments at the same time as going to university to study.
Right. And of course, there's this wonderful added benefit that we can bring some of our best practices and our expertise through media like mixed reality to help in areas where students would normally have access to that sort of learning or that type of simulation. And that's certainly something I know that we're very passionate about at GigXR.
I think the other benefit for mixed reality is that you actually don't need a simulation suite. So you can actually use the headsets in other areas. So they can be used in a hospital to unpack something that someone's learning. You could then take, they're portable and could be used in different places, rather than actually being a high fidelity mannequin, for example, can only be used in a certain space because they're not very portable. Yes, you could move them, but you're not you know, it's not going to be easy to do that. So I think that's something else that's a great aspect.
So I guess the good news then is that mixed reality is helping and it's here to stay.
Yes, I hope so.
Okay, which is probably a great way to bring this conversation to a close. Jane, thank you so much for chatting with me today. I really appreciate the work that you do. Really appreciate the fact that you're such a fan of mixed reality. And I hope that our partnership will live long into the future. Thank you, Jane. I'm David King-Lassman. This is ExploreXR. Thank you for watching. Thank you for listening.